Hello, I'm Deb Trautman, President and Chief Executive Officer of the American Association of Colleges of Nursing. Thank you for the opportunity to join you today. I would like to thank Dr. Weiss, Chair of the Advocacy Committee, the Board of the Friends of the National Institute for Nursing Research, and the ambassadors for the invitation today, most certainly, but more importantly, for your leadership and commitment to advocacy for research and funding for the National Institute of Nursing Research and the important work that nurse scientists do across the country. It is critically important, now more than ever, to communicate the impact of the National Institute for Nursing Research and the contributions of nurse scientists to improving health and healthcare and addressing many of the challenges that we face as a nation. I've also been asked today to share advocacy lessons learned from my past experiences. In addition to having the honor of serving as the President and CEO for the American Association of Colleges of Nursing, I have had the distinct privilege to serve as a Robert Wood Johnson Health Policy Fellow in the Office of the Speaker, Speaker Nancy Pelosi, during the development and the House passage of the Affordable Care Act. And I served as the Executive Director for the Center for Health Policy and Healthcare Transformation at Hopkins, an interprofessional health policy center across the schools of nursing, medicine, and public health. And I've had the opportunity to advance policy at an organizational level at two large academic medical centers. There have been many lessons learned across my journey, but some that I think of that are key that I'd like to share with you today. The first is, during the time I was studying for my PhD, a required reading was a book called The Heart of Power by David Blumenthal and James Monroe. This book looked at the history, 75 years in the Oval Office, and studied the advancement efforts for health policy, in particular, those who were successful, those efforts that were successful, and those efforts that failed. What the authors concluded in one of the summary chapters was that there were certain key elements of great importance to advancing policy. First was passion. Also, though, being able to act with speed, have a plan, be willing to and overrule advisors, those who say that what you're trying to accomplish is not possible, be willing to overrule those advisors, go public and create momentum, be part of and deploy a talented team, and be willing to lose. The policymaking process is incremental, and we do not always win. The next key lesson I also took away from my PhD program, and that was in considering the differences between academicians and politicians. There was a quote that was handwritten in a used book that I purchased. And the quote I will share with you, but first visualize a lamppost. Visualize the lamppost, and this is the quote. Politicians use research and data, much like a drunk uses a lamppost, for support rather than illumination. Now, I share that with you not to depress or disappoint you, or even to be insulting, but to ground us in reality. Policymakers, most policymakers, as most of us, care about advancing policies that we believe will create a better future. However, what has a notable difference is that evidence alone is insufficient to convince all, but evidence will convince and be utilized by those who have a shared interest in the particular policy. So as we are generating new discoveries, new evidence that will help inform policy, I think it behooves us to consider who might have the most interest in not only learning this new information, but potentially including it as they advance policy initiatives. The next key lesson that I think about when I consider the important aspects of what we need to keep in mind as we're advancing policy is the myth Sisyphus. Many of you may recall Sisyphus is, imagine a figure, a man, woman. I believe the illustration mostly shows a man, but in the ancient times pushing a huge boulder by hand up a steep incline. only to reach near the top and then slide back down again. Many say the myth is to remind us about persistence, resilience, and facing adversity. I would suggest resilience most certainly in the policy community and a commitment to be steadfast to the outcomes that we hope to achieve. I had many memorable times when I was in the speaker's office. One of them in particular that relates to this message that I take away when I think about Sisyphus was I had the opportunity to meet with tribal leaders. The tribal leaders were coming to meet with myself and other key policy staffers at the time that we were developing the language for the Affordable Care Act. And the purpose of the meeting was to talk about provisions from the treaties. Well, initially I couldn't understand why we would be meeting about these provisions from the treaties, which had been agreed to years before, some hundreds of years earlier. Well, I came to learn that the tribal leaders were there to make sure that there was language in the Affordable Care Act legislation that then became law that would support these agreements, that would enable the codification of these agreements and put them into policy. So in fact, many of you are aware that the Affordable Care Act does have a section that was devoted to Indian health services. And in fact, many of these provisions that had been previously agreed to became legislative language and ultimately law. The next lesson, when I think about strategy, I, like perhaps you, sometimes wish for a common approach. But what I have learned in the policymaking process is that one size does not fit all. We need to adjust our strategy and adjust our approach based on the audience. We may have a different approach when we're meeting with members of Congress than with the administration. We may have certainly a different approach when we're trying to advance policy within our own organizations. So I keep in mind the key point that one size does not fit all. Two other quotes that also are key lessons that I continue to keep in mind as I think about advancing policy. One from John F. Kennedy. Kennedy said, "Leadership and learning are indispensable to each other." I believe that we have made significant progress in my career, strengthening our effectiveness and our competencies as advocates in nursing for health policy, not only for our special interests, but also for the public interest. But we must continue to learn from our experiences. And then the other quote is an African proverb. The source is unknown. And the quote many of you may be aware of. It says, "If you want to go fast, go alone. If you want to go far, go together." I think that we have also seen a great progression in nursing of speaking with a unified voice. It is very important that while we may have our individual differences as a profession, as a community, we come together with a unified voice. I would like to give a shout out to the nursing community that is now 63 national organizations strong. The nursing community is highly respected for its advocacy and policy voice on the Hill and with the administration. And I would also like to give a shout out to the ambassadors. The collective voice of the ambassadors has become increasingly more prominent and effective in advancing policy, and I thank you for those efforts. I was asked to share briefly. I have recently been invited to be a board member of Research America. I'm honored to be on the board, and I am learning more about the organization. While I'm learning more as a board member, I have long held a strong admiration for the work that Research America has done to increase public and policymaker awareness of the health and economic benefits of research. Research America has helped build a strong base of support from citizens for support of research and innovation. Research America has a historical commitment to education, engagement, and advocacy. I believe that there are many areas of common interest. AACN is a member of Research America. Many of our academic institutions are members of Research America, but we don't have to be a member only. We need to recognize the importance that we share common interests and can be considered key stakeholders. For example, Research America, as the AACN and many other health professions, has a significant concern about the future of the workforce of researchers. We are seeing a decline across health professions and in other areas for those who are interested in pursuing research as a career. Many of the issues that are shared that are either barriers or disincentives are not unique to nursing, but occur across the continuum of professions. I believe this may be an opportunity for us to consider, but certainly there are more on the horizon as we think about how we can be a larger community of key stakeholders around issues of importance to advancing research, science, and discovery. Now, another quote that I would like to share, Thomas Jefferson said, "An educated citizenry is a vital request for our survival as free people, an informed populace." So when we think about the basics of advocacy, of course, we must be informed, and our goal is to inform others. We need to know our strengths and our resources. We, of course, need to know our audience. But we need to think about how we deliver our message, tell our story, make our request. And we need to, of course, collaborate when appropriate. We all know that nurses have been regarded for quite some time as a highly trusted and respected profession for our honesty, our ethical standards in the profession. However, as many of you recall, in 2010, we learned that many, while respecting us deeply as a profession and as individuals, did not see us as influential in the health policy process and being able to advocate for these policy changes or implementing and being responsible for leading these changes. Now, I would like to say that I believe we're proving these naysayers wrong. However, I still think we have a journey yet to travel. So when we think of our advocacy efforts, I do believe it is a balancing act of assuring that we bring the evidence, the quantitative data to bear on not only what the definition of the problem is, but what the solutions may be. But we need to couple that with a personal story. When we have the evidence coupled with a story, I believe it enables us to be more effective. There's a quote I want to share with you from Florence Nightingale that I believe relates to policy, or certainly strategy. Florence said, "When I entered into service here, I determined that happen what would, I never would intrigue among the committee. Now I perceive that I do all of my business by intrigue. I propose in private to A, B, or C the resolution I think A, B, or C most capable of carrying in committee, and then leave it to them, and I always win." So a couple takeaways. One, I've not mastered Florence's "I always win." But I do think this is sage advice. We do need to consider when a voice that's not our own might be more impactful in advancing policy, and when so, have the wisdom to seek out that voice. It doesn't abdicate our responsibility, but I believe it can strengthen our effectiveness. So through advocacy, we are going to continue to lead. Nurses are going to lead in not only transforming health and healthcare, but in addressing the social determinants of health, and I believe in eradicating structural racism. Now more than ever, our contributions are critically important. I thank you for your time, and I thank you for your advocacy.